Hello everyone, I am Dr. Bhavna, a gynecologist. Today we are discussing about the blood tests which are to be done in pregnancy. Meet our today's guest, Dr. Dipneeta Chaudhari. Hello Deepa.
Hi, ma'am.
She is a MD pathologist working in Krishna Diagnostics since 10 years.
Thank you for such a nice introduction, ma'am. Today our topic is actually the blood tests that are done in ANC. So it is named as ANC profile. So what does ANC stand for? ANC is nothing but antenatal care. That is the care that is provided by us, the healthcare professionals, or your gynecologists, the radiologists, and the pathologists. They are a team of healthcare professionals which are helping you throughout the pregnancy so that you have a healthy mother and a healthy child. So these tests are done from the time the baby is conceived till birth. So now we'll be talking about the blood test which is called as ANC profile, which commonly includes these tests. The first test is complete blood cell count, that is CBC, then blood group and RH grouping, then sugar, then we do some infections like HBsAg, that is hepatitis B surface antigen test, the HIV test, BDRL, then we do the urine tests and TSH, which is very important. It is related to the thyroid function.
The first most important test is complete blood count.
Yeah. So as the name suggests, complete blood count is also called as hemogram. It measures the blood parameters, the different types of cells. That is the red blood cells, the white blood cells, and the platelets. So main concern here is to detect anemia, which is the level of hemoglobin which is present in the RBCs.
More than 50% of our ANCs are anemic. So their hemoglobin level is less than 10 gram percentage. So what I found ki most of the times, even if we give the oral iron therapy or even the parental iron therapy, the hemoglobin does not rises. So what should be done in that case?
Yeah. So this is one condition which we can do. So there we have to differentiate whether it is a nutritional anemia or a anemia due to some structural abnormalities in hemoglobin. For that, we recommend further testing like HB electrophoresis, which will detect sickle cell anemia and thalassemia and such other conditions. So most commonly we have nutritional deficiency either due to iron or B12. If not corrected, then ma'am, as she has told, she'll advise some special tests. So the next parameter that we do is the white blood cells. If the count is increased, we detect other infections, or we look at the platelet count, which is very important to see if the patient has thrombocytopenia, that means reduced platelet counts, if they can have any bleeding or clotting disorders during the pregnancy. So then moving on to the next test. Yeah.
The blood grouping is very important.
Blood grouping mainly involves grouping of the mother's blood group, maternal blood group, which is very important because the mother may require blood during pregnancy, so we have to know her blood group. The another component that is very important is RH factor. So you have to know whether the mother is RH positive or RH negative. RH negative mothers require further care and they are a high risk pregnancy. Which
Do we also advise a husband's blood group if the mother is negative?
negative, yes, that is very important because what is the thing is if the mother is RH negative, if she is bearing a RH positive child, so the thing is that the mother's blood passes through the placenta to provide nutrition to the baby, and from the baby also the RBCs can come back to the mother. So being an RH positive cell, these cells when they enter the maternal blood, they will develop antibodies, and this mother's antibodies can attack the fetus. So it is very important for us to know the husband's blood group also, so to know whether there is a chance of having a positive child.
So is there any test if the mother is RH negative, the baby is affected or not?
Yeah. So there is a special test which is called as ICT, that is indirect Coombs test, also called as indirect antiglobulin test. Here we measure the antibodies, whether the antibodies are present in the pregnancy. Usually this is advised at the first trimester and at 24 weeks. So this is when the gynecologist decides whether to give anti-D to the mother or
Yes.
not.
So please list down the infections, list what we advise to the patients in pregnancy.
Yeah. So as I told you earlier, the placenta, through the placenta from the mother to the child, some infections may also pass. So we have to screen for these tests. The tests that we include in the profile, they're just screening tests. They are not confirmatory tests. So what we do is commonly do for hepatitis B, which affects the liver. Then we do HCV, that is again hepatitis C virus. Then we do a screening test for HIV and VDRL. VDRL is done for syphilis, which is again an infection which can even cause congenital blindness in the child. So all these can be detected early and managed accordingly.
Okay. Moving to the next lane, which is the sugar levels. In our country, diabetes is very common, and the incidence is increasing day by day.
Yes.
So, what about gestational diabetes?
Yes. So it's a very small test which is called a sugar. So usually done as a random sugar or a fasting sugar as advised by the gynecologist. So what we are here detecting is whether the patient has a high blood sugar. So why we are concerned about this high blood sugar? So there's a condition which, as ma'am said, which is called as gestational diabetes. This is a special condition where the diabetes develops during pregnancy, and after the birth of the child there is no diabetes. So, and why are we concerned about this gestational diabetes? Because it leads to some complications.
Causes lethal complications in the baby also.
Yes.
So there are two types of diabetes. If the patient is already diabetic, then we called it as over diabetes. In that case, if the sugar levels are high in first trimester, then there are high chances of developing abnormal babies. And in the latter gestation, the increased weight, what we call as macrosomia, increase the amount of liquor, and stillbirth are also common. So we have to monitor the sugar very meticulously. Yeah. So, what are the next tests in case of diabetes?
Yeah. And the clinician suspects that you have gestational diabetes, it's very needed to confirm it. So 24 to 28 weeks, they will advise you a test which is called as OGTT, that is oral glucose tolerance test. So, so what we do in this test is first the patient has to remain fasting for at least 8 to 10 hours. Then a blood sample is taken as a fasting sample. Then the patient will be advised to just take a glucose syrup of 75 grams and nothing else, no food. And then the blood will be taken at 1 hour interval and at 2 hour interval. So then the readings are interpreted as whether if the levels are high, then the patient is labeled as gestational diabetes, and then the further care is provided. Excellent.
So, our next in the list is the thyroid functions test.
Yeah, I would just like to add, along with OGTT, we can also advise HbA1c. Okay, this is also a test to detect gestational diabetes. Here we get an average sugar over 2 to 3 months. So this is also a special test which is done by HPLC method, and this will also help you in monitoring whether your sugar is in control or not throughout the pregnancy.
So the thyroid levels we also advise. Yes. For the first 10 to 12 weeks, the fetal thyroid gland is not functioning, so the baby has to depend on the mother's hormone level completely. So what are the tests we advise commonly?
Yeah. So the commonly included test in this profile is TSH, which the full form is thyroid stimulating hormone. So as the name suggests, it is a stimulating hormone. The thyroid gland, which is located in our neck, it secretes the thyroid hormones, which is very important for the entire body function, from brain development to menstruation to pregnancy, everything. So it is very important to monitor these levels. So what happens, this thyroid stimulating hormone stimulates the thyroid gland to produce thyroid hormones. So if the thyroid TSH levels are high, this indicates that your thyroid gland is not functioning properly and not providing enough hormone in the body. So it is very important to measure this TSH level. So usually in pregnancy, up to 3 is considered as normal. If it is above 4.5, then the patient is labeled as hypothyroid and the further care is provided.
Yes. And last but not the least is the urine routine and microscopy test. Please elaborate.
Yeah. So urine test requires just that you will be asked to give a sample of your urine in a urine container about 5 to 10 ml. So here what is done is we can detect infections basically if there are any pus cells present. So this has an implication in pregnancy, because if the infection is chronically present, it can lead to
Preterm labors and all.
So it is very important to monitor that. And also we measure something called as the protein, the albumin, which indicates whether the patient has hypertension or other conditions.
And likewise also the sugar levels we check in urine.
So sugar level is can be also measured in urine, especially we look for ketones and other things, so which needs to be monitored, especially in cases of gestational diabetes.
So here I already covered the basic test like the complete hemogram, then the blood grouping, then the infections, which are the type of infection that the test done, then the sugar, importance of sugar test, then thyroid function test, and the last is urine routine microscopy. So for optimum fetal growth and mother's well-being, you must consult your doctor and get the test done. And if any abnormality detected, the doctor will advise the treatment and the correction. So our aim is for antenatal test is
Healthy
healthy baby and
and
healthy
healthy
mother.
mother.
If you have any queries, please let us know in the comment box, and keep watching and share with your friends and family and subscribe our channel.
Thank
Thank you.
you.